Whenever the spirit moves.
According to a study done by the Henry J. Kaiser Family Foundation in 2017, non-citizens are more likely to be uninsured among the non-elderly population. 17% of lawfully present immigrants and nearly 4 in 10, 39% of undocumented immigrants are uninsured compared to less than 1 in 10, which is 9%, U.S.-born and naturalized citizens. End quote. This was very troubling to me when I read it, especially for undocumented immigrants, because there is a 30% difference between undocumented immigrants and U.S.-born and naturalized citizens of who has health insurance and who does not. In order for you to understand what I'll be speaking about today, I'm going to talk about 3 key definitions that you need to know. So a definition of a non-citizen includes both lawfully present and undocumented immigrants, end quote. An undocumented immigrant, according to Immigrant Health, is persons who do not have the U.S. government's permission to live and work in the country, end quote. And a naturalized citizen is a foreign-born individual who obtains full, officially recognized citizenship in another country, end quote. I was interested in this topic of the healthcare system in the United States because my mother works in the healthcare industry, and as I was beginning to research, I thought about how people in the United States obtain healthcare through private or public sectors, and then I thought about how immigrants can obtain healthcare, specifically undocumented immigrants, and how that affects the well-being of them. So this semester, I plan to research how access of healthcare affects the well-being of undocumented immigrants, and today I'll be talking about key issues, research, and how this topic fits into social justice. So first, I'm going to talk to you about key issues to help you understand how the access to healthcare of undocumented immigrants affects their well-being. 83% of undocumented immigrants work in low-wage paying jobs, which means that their employers don't provide healthcare benefits to them, and they don't make enough money in order to be able to purchase private healthcare, and nor do they qualify for public healthcare such as Medicare or Medicaid because they're undocumented. This means that if a health issue arises, they're less likely to seek medical care, go to the doctor or the emergency room, and this could end up being detrimental to them and their family because they could potentially have to quit their job or lose their job, and then they lose that household income that their family is relying on. The second main issue is the issue of politics. So many people in America feel that undocumented immigrants hurt the economy and don't pay into the economy, whereas other people in the United States think the complete opposite. This can be very polarizing in politics because Republicans and Democrats, in order to make any type of legislation, they have to agree on this topic, and it usually is very challenging, and they usually do not agree on this, and so no legislation is passed. Now that I've explained 2 key issues, I'm going to discuss the research that is going to help me develop my topic more. I plan to look more into the Affordable Care Act and the role it plays in the health equity for lower-class undocumented immigrants. And I also plan to look at the health access of California's Consumer Coalition organization, which fights for access of health care to different groups of people, specifically undocumented immigrants. So now that I've talked about key issues and research, I'm going to talk about how this fits into the realm of social justice. So we read an article called Conceptual Foundations and for our social justice readings, and there's different dimensions of oppression. One is at an institutional level, and a less visible sign of this is healthcare benefits. And as I talked about before, undocumented immigrants do not have as many healthcare benefits, if any, and this, if their condition worsens, if they have any type of health problems, they lose that income that their family relies on. And according to an article, Immigrant Health, household income for non-citizens was $27,400 annually. And so this is a problem because if they don't have that job because of health issues, they could get deeper into poverty, creating a very challenging cycle to break out of. So we should care about this because no matter the status of a person, we're all people, and we all deserve to have a life that we can live, and we all deserve to be healthy. In conclusion, I've talked about key issues, research, and how this fits into social justice. and the access of health care for undocumented immigrants strongly influences their well-being. I hope that in the future that 39% that lives without health care or any health care benefits, that this number can be changed and lowered. Thank you.